Chin up and get back to work. Don't be such a delicate darling. Cramps can't be that bad. Haven't we heard this much too often? Although painful periods are the most common cause for absenteeism at work, school, or university, it doesn't get the acknowledgement it deserves. I'm sure every woman would have experienced this at least once in her lifetime. And if not, thank your lucky stars. The question that's most ruminated over each and every month, perhaps for years together, is my painful period normal or not? Today, let us discuss the same in detail, along with a few do's and don'ts in painful periods, how it can be prevented, and a few remedies that are easily available and helpful to subside pain. So keep watching till the end. Hi everyone, welcome back to my channel, Womb to Superwomb. I'm Dr. Samata with you on this journey towards a healthier you. In the last video, I spoke about 5 recommendations you should know and try to incorporate in your lifestyle a year or at least 6 months before you plan to conceive. If you have missed, please find the link in the description below. Watch, like, share this video and subscribe if you haven't. Press the bell icon and be the first one to get notified. As we all know, period or menstruation is just one phase of a menstrual cycle in which the innermost layer that lines the uterus, called the functional endometrium, sheds, which otherwise helps to support the growth of a new life in a pregnant uterus. The interval between beginning of one period to the next one, meaning the next month, is one menstrual cycle, and the bleeding phase is called period or mens or menstruation. Before we talk about painful periods, let's know what is a normal period. Usually, period that starts around 13 years of age, somewhere between 11 and 15 years, and ends between 45 and 55 years of age. Once a period starts, if it recurs continuously in cycles, every 21 to 35 days, most often 28 days, excluding the first year, is normal. The duration of bleeding every month should be between 2 and 7 days, average considered as 4 to 5 days. The amount of bleeding should be around 20 to 80 ml, average being 35 ml. That is 3 to 4 fully soaked sanitary pads, especially on the second day when the flow is usually heavy. There should be no intermenstrual bleeding, that is, bleeding between the two periods. No bleeding after sexual intercourse, and no post-menopausal bleeding, that is, there should be no bleeding after a woman attains menopause. Now, coming to the crux of the issue, painful periods, are they normal? No pain or slight tolerable crampy pain in the lower abdomen with low back pain and in thighs during periods which does not interfere with your daily activities is normal. It could be associated sometimes with nausea, 1 or 2 episodes of vomiting, fatigue and headache, especially on the first day. Some of you all might have experienced a similar pain for a shorter duration once in a while around 14th day of your cycle when you ovulate. This is called ovular pain, which is also normal. Then what is an abnormal period? Periods that do not conform to the features of a normal period, as I told earlier, all come under abnormal period. But keep in mind that the characteristics of the pain, that is the severity, location, duration of the pain, must be the same as you generally feel. Coming to the causes of painful periods. First, lack of essential nutrients in the diet. The first and foremost reason for a person to get sick and recover easily depends on the intake of essential nutrients. If she has adequate essential nutrients in her diet, her body has the capability to fight diseases and recover from illnesses. For example, If a woman has iron, folic acid, or vitamin B12 deficiency and develops moderate to severe anemia, the oxygen supply to the muscle layer of the uterus decreases and she may end up having high chances of cramps in periods. In teenagers, tension and anxiety may make them more sensitive to pain. Next, a chemical named prostaglandin, a specific type called PGF2 alpha, reduces the blood flow to the muscular layer of the uterus and at the same time increases contractions of the uterus leading to pain. A hormone called vasopressin is found to be released more in patients who have painful periods without any underlying cause. The reason this hormone causes pain is because vasopressin releases prostaglandins and causes pain. Most importantly, when you have any pelvic pathology, including improper development of reproductive organs, say bicornuate uterus, meaning the uterus will have two cavities with one cervix or two cervices. When should you see a doctor for painful periods? You must see a doctor if you have even one of these that I'll be mentioning. Firstly, you have had years of painless periods and now suddenly you develop pain which is persistent every month. Secondly, in the past you had tolerable pain in menses, but now it is increasing in intensity or duration and is becoming intolerable. Third, when you have dull pain which starts a few days before the day of expected period, worsens during period and lasts even after you stop bleeding. Fourth, you have pain in between your periods besides during periods. Fifth, pain is intolerable that you may need many painkillers up to thrice a day and still no relief. For the next half a minute, hold on tight and let us quickly run through a few terminologies which we as women should know. Painful periods that are debilitating enough to hamper your daily activities are medically called dysmenorrhea. There are two types of dysmenorrhea, primary and secondary. Primary dysmenorrhea is generally seen in adolescent or younger age group. The pain usually starts a few months to a year after her first period. This pain could subside following pregnancy or delivery of a child, especially after a normal delivery, and most importantly, without having any pelvic pathology or problems related to the organs situated in the pelvis. Next is secondary dysmenorrhea, is when there is pelvic pathology which is causing pain. There are many causes for secondary dysmenorrhea. A few of them are endometriosis, adenomyosis, uterine fibroid. How can we manage painful periods? In primary dysmenorrhea, treatment is aimed at relieving pain, as we know there is no issue as such that needs to be taken care of. But in secondary dysmenorrhea, the goal is to find out the exact cause and decide the most appropriate treatment. Hence, it is necessary to see a gynecologist to know if there is any pathology being the reason for your pain. Do's for the prevention of cramps. For girls who are entering puberty and early teenagers who have painful periods can be counseled to overcome the fear of pain and encouraged to adopt the measures that we'll be discussing today in their routine so that it may reduce the severity of pain and improve their overall health as well. Firstly, foods rich in iron and folates like spinach, broccoli, raisins, apricots maintain normal levels of hemoglobin for adequate oxygenation to uterus, reducing the cramps. Secondly, foods rich in potassium include mushrooms, beans, bananas, pomegranate. Addition of potassium to the diet helps to reduce cramps by balancing the low blood potassium levels and helps to reduce uncontrolled and prolonged contractions, otherwise called cramps. Third, drink a glass of tender coconut water at least thrice a week. Fourth, physical activity and exercises. Research has shown that women who exercise regularly tend to suffer less from menstrual cramps. Abdominal core muscle strengthening exercises like planks, cycling, and squatting help to reduce cramps, but during periods, you can do light exercises. Fifth, yogasanas. There are specific yogasanas when performed daily help to relieve pain, which I will be demonstrating shortly in my upcoming videos. These do's are more effective when followed throughout the month and adopted as lifestyle changes. Don'ts for painful periods. First, avoid foods such as potatoes, sweet potatoes, cabbage, chickpeas a few days before your expected date of periods because these food articles cause flatulence which can increase the pressure in the abdomen which in turn causes pain. Secondly, avoid sugary, aerated and alcohol containing beverages. Third, during periods, girls mostly stay in bed throughout the day. Although not easy, it is better to walk around in the house or balcony and perform comfortable yogasanas. A couple of remedies you could do at home include firstly, keeping hot water bag on lower abdomen, but be sure the water is not very hot to cause burns. Second, soak half a teaspoon of fenugreek seeds in a glass of water overnight and consume next morning on empty stomach. Third, a few small slices of ginger should be boiled in a glass of water, reduced to half and strained. Jaggery, preferably melted jaggery, should be added to this decoction and taken on the first day. This helps to relieve pain. Generally, the medical line of treatment is painkillers. But if you follow the above said measures for a couple of months, you will certainly see a difference in your symptoms. In Ayurvedic scriptures, there are various effective medications for internal administration and medicated enema formulations which help in relieving painful periods. Please seek a specialist's medical advice for the treatment. In my next video, we will be discussing everything you need to know about pap smear test. Do not forget to like, share, comment and subscribe if you haven't. Stay healthy and stay tuned. Thank you.